Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Tracy, according to the American Academy of Pediatrics, also known as AAP, there are some 3,500 infants who die every year in the United States due to what is called a sleep-related death. And that includes sudden infant death syndrome as well as accidental strangulation and suffocation. The number of infant deaths did decrease in the 1990s after a pretty successful national safe sleep campaign. But the number of infant sleep-related deaths has plateaued more recently.
With the goal of decreasing infant sleep deaths even further, the AAP released updated recommendations for a safe infant sleeping environment in November. Here to discuss the latest sleep recommendations for infants is pediatrician Dr. Esther Krych. Dr. Krych is also co-medical editor of the book, Mayo Clinic Guide to Your Baby's First Year. Welcome back to the program, Dr. Krych.
Thank you for having me.
Thanks, Dr. Krych, for being here. So let's see, you write books, you're on the radio. I know that you're married to an orthopedic surgeon who's a great guy, also in our department. So you're a busy woman. I can't think of anything much more tragic than an infant dying in their crib. So I know that there have been some recommendations in the past that we're all pretty much aware of, but tell us about the new recommendations from the American Academy of Pediatrics.
Sure. Absolutely. I think there's nothing worse than if an infant should suddenly die unexpectedly. When it happens for reasons that are completely unexplainable, we call that SIDS, sudden infant death syndrome. And as you alluded to, the recommendations in 1992 were the Back to Sleep campaign. Then in 2005, they expanded the recommendations for firm sleep surface, nothing extra in the crib. And then these latest recommendations are really related to the sleep environment in addition to those things because of the plateau that we've seen. Can we increase kids' safety even further by modifying the sleep environment?
So what's new in these latest recommendations?
So the new thing is the recommendation to have children sleep in their parents' room up until 3 months of age or older if it suits the family. There's some evidence to say that this could reduce the risk of SIDS by 50%. The mechanism of how that happens isn't exactly clear. Some theories are that it's related to the infant not sleeping as deeply. Some people think it's because the parents are right next to the infant and they're able to react more quickly.
Yeah, but react to your child not breathing?
Right. So that's where I think we don't exactly know what part of sleeping together is it that reduces the risk as much as 50% in the best case scenario. We don't have that answer yet.
The first time that I heard this, I have to say my eyebrows shot up because I thought, what? Putting a baby in the bed? Oh, no, it's bringing the baby's bassinet or crib into the parent's room, not in the parent's bed.
Exactly, yeah.
And why is that a bad idea?
It's related to the asphyxiation, strangulation piece that you had mentioned earlier. There's a risk that if the baby is in the bed with a very exhausted set of parents, that those parents could inadvertently roll on the child or a pillow could land on the child's face, and that could be tragic.
And you hear those stories. Very sad.
So I see you don't want your baby in bed with you.
Ideally, no.
And you don't want your pet in bed with you either, but some people, I guess it's all right if you roll over and kill your dog.
No, that's terrible too.
Certainly not your child.
But there are some parents that swear by it. And so are there ways that you can successfully or more safely do a co-sleeping thing?
Well, ideally, you wouldn't co-sleep. But the AAP has said that if you're going to feed your baby at night, pull them into the bed with you and feed them in your bed. That's a safer place than feeding them in a recliner and then falling asleep holding your baby in the recliner. So ideally, in a perfect world, we'd all feed our babies, stay awake, and put them back in their crib, which is located right near our beds. The world's not perfect. So if you're,
but those are best
case scenarios. Yeah.
And what about a pacifier?
Yeah, so the AAP also has recommended that use of a pacifier at sleep onset can reduce the risk of SIDS. The pacifier doesn't have to be replaced during sleep if it falls out, and the effect of the pacifier is supposed to last through the infant's sleep. But it's a recommendation. I wouldn't say it's as high a level of evidence as the Back to Sleep campaign. Firm mattress, nothing else in the mattress. And it's
Nothing else in the bed, so no toys or teddy bears or anything like that.
Crib bumpers or blankets.
Yeah, that firm mattress thing that you said in 2005 is when that happened.
Yeah.
That's right between the ages of my kids. And so I got that message with my second child, and it seemed so bizarre to have him in the bed, in a sleeper, just him, nothing else.
Yeah.
But now that is the way that it's supposed to be.
It is. And as kids get older, that's not a bad thing anyway, because those things can be used as a step, which then allows them to get out of that crib and potentially fall and injure themselves.
Do we have any idea of the children who do die of SIDS, and how many is that a year?
I don't have that number on the top of my head, what exactly the rate of
What did we say,
SIDS is.
3,500 a year? But
Yeah.
that includes suffocation and asphyxiation.
Yeah.
So it's a pretty large number. Do we have any idea of the children who die of SIDS, why that happens?
No. And that's why it's one of those big unexplained that we keep searching for. What is it we can do to reduce it, because we don't know what causes it. There are certain children who we have classified as SIDS deaths, and then we later find out they maybe had a cardiac channelopathy or they had an arrhythmia.
A cardiac what?
A electrolyte channel problem in the heart that causes an arrhythmia.
Oh, okay.
And so sometimes we find out later why those children died, and they were classified as a SIDS initially.
But in fact, it might have been a heart problem, an electrical problem of the heart.
Of the heart, right.
What about swaddling? That's one of the things that you hear about. I like to call it making a baby burrito, but
Right. Yeah, which
what
it
about
is.
swaddling? Isn't it supposed to comfort them?
It is supposed to comfort them, and I think swaddling, when done right in a small child who isn't going to be able to get out of the blanket, is safe and effective and can be very effective in comforting a fussy infant. As that child gets older, 3-4 months, and they're stronger and they're able to get out of that blanket, it's probably time to think about stopping swaddling.
So is there pretty good evidence that putting I presume the reason you don't put a baby on their stomach is because they can potentially suffocate, because once they're on their stomach, they can't roll over? Is that?
Right.
So that's why a back to sleep campaign.
Right. And
Put your
back
baby
is-
to sleep on their back.
Exactly. And back is considered safer than side.
And there's those products, though, that can, like the little widget
Yeah.
that wedges to hold them. Are those a good idea?
They're not really.
Okay.
So there isn't anything out there that you can add to the bed that might help prevent
No,
SIDS.
the best thing you can do is remove things from the bed to prevent SIDS.
And finally, what about the people who like to let their kids sleep in their car seats?
Yeah.
They're not laying on their stomach.
They're not. They're not. In young infants, it's not recommended because of the neck angle. Potentially in a prolonged sleep with the neck at an angle, it could lead to a suffocation or asphyxiation theoretically. If you're going on a long car ride with a normal, healthy baby, you should be fine. If you have a baby with health problems, we usually recommend you check with your physician before going on a long car ride if you know that your infant might be a risk.
All right, so the new recommendation once again is put the baby to sleep in its crib with nothing else in it, in your bedroom, but not in your bed.
Exactly.
And how long should that crib stay in the parents' room?
Ideally, at least up until 3 months, 6 months if you can handle it.
All right.
And then put them back in your room when they're teenagers. Dr. Esther Krych, thanks so much for being with us. She's co-medical editor of the highly acclaimed book, Mayo Clinic Guide to Your Baby's First Year. She's a pediatrician at the Mayo Clinic. Thanks for bringing us up to date with the new recommendations.
Thanks for having me.